What is a stress thallium test? If you're curious about how your heart functions, especially when it's under stress, you might have heard of a stress thallium test. Let's break down what this test is all about and why it's so important. A stress thallium test, also known as a nuclear stress test or cardiac stress test, is a diagnostic procedure that helps doctors see how well blood flows into your heart when you're exercising and when you're at rest. This test is particularly useful for identifying any issues with your heart's blood supply, which can be a sign of conditions like coronary artery disease. Here's how it works. A small amount of a radioactive substance called thallium is injected into your bloodstream through an intravenous line, usually in your arm. This thallium acts as a tracer that makes your blood flow visible to a special camera called a gamma camera. As your heart pumps, the thallium travels through your blood vessels, and the camera takes pictures of your heart to show where the blood flow is normal and where it might be reduced. The test is typically conducted in two phases, one while you're resting and another while you're exercising. If you can't exercise, don't worry. A medication like adenosine can be used to simulate the effects of exercise by making your heart beat faster and harder. During the exercise phase, you'll be asked to walk on a treadmill or use a stationary bicycle. The exercise will start slowly and increase in intensity. Once your heart is working at its peak, you'll stop exercising and lie down for the gamma camera to take more pictures. This process is repeated after a few hours to get a complete picture of your heart's function both during stress and at rest. To prepare for the test, you'll need to follow some specific instructions. You should avoid eating, drinking, or consuming caffeine for at least 6 hours before the test. Wear comfortable clothing and shoes suitable for exercise, and discuss your medical history and any medications you're taking with your doctor. The entire process usually takes about 3-4 hours, including preparation, the stress test, and the imaging phases. While the test is generally safe, there are some minor risks to be aware of, such as mild chest discomfort, shortness of breath, or an allergic reaction to the thallium. These are rare and usually managed well by medical staff. The results of the test can show several important things: the size of your heart chambers, how effectively your heart pumps, how well your coronary arteries supply your heart with blood, and if your heart muscle is damaged or scarred from previous heart attacks. In summary, a stress thallium test is a powerful tool for doctors to assess your heart health, especially when it comes to blood flow and potential heart conditions. By understanding how your heart functions under stress and at rest, this test helps in early detection and effective management of heart diseases.